We will talk about low-grade fever. Low-grade fever is when fever is more than 99 Fahrenheit but less than 100.3 Fahrenheit. And if this fever lasts less than 3 days, it's nothing usually and it's not worthy to pay important attention. But if fever lasts more than 7 days, of course, it requires medical evaluation. Now let's say what are the most common causes of low-grade fever which lasts more than 7 days. First and most common cause is infection. In 40% of cases, infection is responsible on low-grade fever, and especially it can be urinary tract infection, and at this case there is burning during urination, cloudy or smelly urine. Second infection which causes low-grade fever, which is prolonged, is tuberculosis. Tuberculosis is bacterial infection and it causes coughing more than 3 weeks, night sweats, bloody sputum, weight loss. Maybe these symptoms not presented, especially for example bloody sputum, but there is night sweats, weight loss usually, and coughing. It's sign of tuberculosis. And endocarditis, also important condition. It's inflammation of heart valves and heart endocardium, and it causes weakness, aching joints, leg swelling, shortness of breath. It's serious condition and it requires medical attention. Second most common cause of prolonged fever, low-grade fever, is autoimmune disease. Autoimmune disease is when our immune system mistakenly attacks our body, our tissues. Such cases are responsible on 20% of cases, and most commonly it's due to rheumatoid arthritis. Rheumatoid arthritis causes joint pain and morning stiffness, especially when person has joint pain after prolonged inactivity. Also, systemic lupus erythematosus is autoimmune disease which causes fever, low-grade fever, and characteristic for the disease is skin rash, butterfly type skin rash across the cheeks and nose, and especially in women. Also, inflammatory bowel disease is important condition which cause fever. In this case, we have abdominal pain, cramping, diarrhea, and sometimes blood in the stool. And in 10% of cases, we have fever because of medications, especially some antibiotics, some hormones, and anticonvulsants causing low-grade fever. And you can guess it easily because the time of fever matches when you start intaking the medication, so it's easy to identify. And fever of unknown origin means that we can't identify the cause of fever, is responsible on 10% of cases, and at this case we continue medical testing to identify what is underlying cause. Sometimes it's literally impossible to find underlying cause. Such cases also happens. And cancers occurred in 5% cases around. It's not common, it's rare, but it's serious. But here is important hint that most cancers does not cause fever at early stages. So if person is generally healthy, no other symptoms, and person has fever, usually it's not cancer. When person has cancer and fever, usually it's in advanced stage. But during lymphoma and leukemia, in some cases, we can have fever as an early symptom, but it's not common. It's in rare cases. And lymphoma is cancer of lymph nodes and lymph system, and at this case, lymph nodes are enlarged in the cervical region or in the groin, or it depends. And fever can be symptom, and blood tests are important also in case of leukemia also, but especially in case of acute leukemia, fever can be early symptom, but such cases, as we said, are rare. So cancer can be cause of low-grade fever, but such cases are rare, and usually it's not first symptom, and usually person already know, or person has already constellation of other symptoms, and one of the symptoms is fever and not separately fever. Most cases it's infection, sometimes it's autoimmune disease, sometimes medication, and sometimes unknown origin. That's all I wanted to say. Thank you for your interest, thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.